there have been significant advances in how we prevent and treat cardiovascular disease. And so what we wanted to do was understand the impact of these changes on patterns of death and disease in different countries around the world. And we included in this analysis of the PURE study about 160,000 middle-aged adults from 21 countries. And we have represented countries of high, middle and low income from around the globe. These individuals have been followed up for about 9.5 years now. So over that time, we're able to track who's developed disease, what sort of disease they developed, and what the consequences were, and in fact, whether they died and what they died from. What is now more common are non-communicable diseases, and of that, overall, cardiovascular disease is the biggest killer in high, middle and low-income countries. However, within non-communicable diseases, there's also been a change in patterns. We find that amongst high-income countries, and even in some higher, so-called upper-middle-income countries, cancer is now the most common cause of death, having overtaken cardiovascular disease for the first time that we can tell. The other major finding that we had is that there is a strong relationship between markers of people's access to healthcare and outcomes. So for instance, the more cardiovascular medications are used, the lower the rates of mortality we observed. The more hospital utilization we observe in a given country, the lower the rates of mortality seem to be. It's important in all countries, but especially in low and middle income countries where cardiovascular death rates are very high, that ongoing efforts to improve access to preventive therapies and to treatments for cardiovascular disease, that gets really promoted very strongly to try and reduce death. But it's important to recognize the emergence of cancer, especially in high-income countries, as an important cause of death. And it's very likely that if trends in lower income countries follow high income countries, which they often do, that cancer may in a few decades become the biggest cause of death worldwide. And we really need to focus on identifying strategies for preventing cancer and promoting effective treatments to reduce death rates and morbidity from cancer.